Mental health is an area of medical treatment that has been stigmatized over the years. It is a service line where people don't want to go until the need arises.
JPS Health Network is a major provider of behavioral health services, both from a crisis perspective, inpatient and outpatient. JPS, here we have the full continuum of care.
What we've done here within behavioral health is to make sure that whatever we do is for the population we serve. So this would be the connection population. It'd be for the population that we can say are underserved. But we do not deny care to anybody who needs care from us. So we've had people from all stages and acts and levels of socioeconomic come and receive our services. We deny nobody.
I am just proud to know that we offer services where people can come in, receive the care they need. They're treated with respect as a whole person, and the outcomes affect their life and the lives of their family and those that they're connected with.
We have a very large outpatient program in behavioral health here at JPS. We do amazing work. That's where the work really has to continue, because people come into the hospital, it's really for crisis, learning to live with your illness, learning to get better, have recovery. That all happens in our outpatient setting.
What we offer in outpatient behavioral health is a full continuum of care, meaning that a patient can receive all the care they need in our clinics, regardless of what those needs are.
We have 6 locations so that we are able to treat patients in the areas where they live. They can come to the clinic that is closest to them and most convenient for them to receive care.
When we're passionate about what we do, we care about people, genuinely care about people. I think we all just share just a genuine concern for people in the community and wanting to help them. You're just a human being that might be going through things that needs a little help. And that's what we're here to do.
Mental health is health. It's about being well as a whole person. And because of that, it's important that we are active in combating stigma and not only making accessible services, but also being a presence in the community to be inviting. We don't always want to demand people to come to us. We want to make the service available to them in the places that they are comfortable. And one of the ways that we've done that is really hardwiring the access to telehealth services and allowing patients to access a lot of the care that they need from the comfort of their home.
We have 2 state-funded programs that were funded by the Texas legislature, and they're called CPAN and TCHAT. TCHAT stands for Texas Child Health Access Through Telemedicine. And with this program, we have therapists that are on staff, and we have mental health clinicians that are able to provide medication management for students in our catchment area. We also have CPAN, which stands for a Child Psychiatry Access Network. We can have pediatricians and PCPs in our catchment area call a 1-888 number to get resources for their patients, and then they can also get a consultation with a child psychiatrist over their questions over mental health.
It can be pretty scary when your kid's been hospitalized or been seen in the ER, and what do you do next? How do you help and support them? So it's really nice to be able to have an appointment pretty soon after to be able to talk that through. So we developed a clinic called ATL, which is for Assessment, Treatment, and Linkage. And that clinic is specific for hospital discharges from our hospital, so within JPS, or ER discharges. Oftentimes families are just not sure how to navigate all of that, and the nice part about this clinic, one, we assess to make sure you're doing okay. We help provide the treatment with making sure your medications are doing right by you, you're not having side effects, making sure you're getting the refills you need, and making any changes that might be required, and linking you up with outpatient psychiatric care as well as therapy resources. So it's really nice because it helps support families to feel like they're not left out in the community on their own, that there is someone who really wants to help them step by step. And so that's the nice thing, it's a step-by-step approach.
Being able to teach kids how to appropriately deal with those stressors so they can be healthy adults and enter into healthy relationships, that's my why. I want to see people thrive and grow and be their best selves, and that's what helps me come to work every day.
And these are medication management clinics, but we also have more intensive services through our partial hospitalization program. That is 5 days a week, patients are able to come in and receive a higher level of care than they would receive in med management. And during that time, they will have group therapy sessions, some individual therapy. They will see a physician or advanced practice provider if there are concerns or questions about medication management during that process. Our next level is our intensive outpatient, where patients go 3 days a week with the same level of services, with the exception of seeing a physician or advanced practice provider.
We focus on curriculum-based such as self-esteem, self-care, trauma, coping, and many other topics that will help them in their daily living, getting back to their daily life.
We're always looking at how do we create a better, safe environment for our people in Tarrant County to have a touch point.
I just love coming in every day knowing that something that we're going to do, a service we're going to offer, is going to actually make an impact and change someone's life.
If one person helps somebody, then together we help a whole bunch of people.
That's what we really aim to do, is that if there's something in your way, keeping you from becoming who you want to be, we're there to help you get to where you need to be.